Are you feeling that you affected by coronavirus?
Since the virus first popped up in Wuhan in people who had visited a local seafood and animal market, called the Huanan Seafood Market, officials could only say it likely hopped from an animal to humans. In a new study, however, the researchers compared SARS-CoV-2, formerly 2019 nCoV, genetic sequence with those in a library of viral sequences, and found that the most closely related viruses were two coronaviruses that originated in bats. Both of those coronaviruses shared 88% of their genetic sequence with that of SARS-CoV-2. Based on these results, the authors said the SARS-CoV-2 likely originated in bats. However, no bats were sold at the Huanan Seafood Market, which suggests that another yet-to-be-identified animal acted as a stepping stone of sorts to transmit the virus to humans. A previous study suggested snakes, which were sold at the Huanan Seafood Market, as a possible source of the new virus. However, some experts have criticized the study, saying it's unclear if coronaviruses can infect snakes. As of February 13, there have been 3 reported deaths from the new coronavirus outside of China. These include the deaths of a 44-year-old man in the Philippines, a 39-year-old man in Hong Kong, and a woman in her 80s in Japan. To determine how easily the virus spreads, scientists will need to calculate what's known as the basic reproduction number, or R0, pronounced R0. This is an estimate of the average number of people who catch the virus from a single infected person. A study published January 29 in the New England Journal of Medicine, NEJM, estimated an R0 value for the new coronavirus to be 2.2, meaning each infected person has been spreading the virus to an average of 2.2 people. This is similar to previous estimates, which have placed the R0 value between 2 and 3. For comparison, SARS initially had an R0 of around 3, before public health measures brought it down to less than 1. In general, a virus will continue to spread if it has an R value of greater than 1, and so public health measures to stem the outbreak should aim to reduce R0 to less than 1, the authors of the NEJM paper said. On January 30, the World Health Organization, WHO, declared that the new coronavirus outbreak is a public health emergency of international concern. The main reason for the declaration is concern that the virus could spread to countries with weaker health systems, WHO said. As of February 9, more people had died from the new coronavirus than from SARS, which killed 774 individuals worldwide, according to the New York Times. MERS and SARS have both been known to cause severe symptoms in people. It's unclear how the new coronavirus will compare in severity, as it has caused severe symptoms and death in some patients while causing only mild illness in others, according to the CDC. All 3 of the coronaviruses can be transmitted between humans through close contact. MERS, which was transmitted from touching infected camels or consuming their meat or milk, was first reported in 2012 in Saudi Arabia and has mostly been contained in the Arabian Peninsula, according to NPR. SARS was first reported in 2002 in southern China. No new cases have been reported since 2004, and is thought to have spread from bats that infected civets. The new coronavirus was likely transmitted from touching or eating an infected animal in Wuhan. During the SARS outbreak, the virus killed about 1 in 10 people who were infected. The death rate from COVID-19 isn't yet known. In the beginning of an outbreak, the initial cases that are identified skew to the severe, which may make the mortality rate seem higher than it is, Alex Azar, Secretary of the U.S. Department of Health and Homeland Security, HHS, said during a news briefing on Tuesday, January 28. The mortality rate may drop as more mild cases are identified, Azar said. Currently, most of the patients who have died from the infection have been older than 60 and have had pre-existing conditions. Symptoms of the new coronavirus include fever, cough and difficulty breathing, according to the CDC. It's estimated that symptoms may appear as soon as 2 days or as long as 14 days after exposure, the CDC said. The NEJM study published on January 29 estimated that, on average, people show symptoms about 5 days after they are infected. There are no specific treatments for coronavirus infections and most people will recover on their own, according to the CDC. So treatment involves rest and medication to relieve symptoms. A humidifier or hot shower can help to relieve a sore throat and cough. If you are mildly sick, you should drink a lot of fluids and rest, but if you are worried about your symptoms, you should see a healthcare provider, they wrote. This is advice for all coronaviruses, not specifically aimed toward the new virus. There is no vaccine for the new coronavirus, but researchers at the U.S. National Institutes of Health confirmed they were in preliminary stages of developing one. Officials plan to launch a Phase 1 clinical trial of a potential vaccine within the next 3 months, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said in a news conference on January 28. Researchers are also working on gathering samples of the virus to design a therapy that will train patients' immune cells to detect and destroy the virus, Fauci said. The best way to prevent infection with COVID-19 is to avoid being exposed to the virus, according to the CDC. In general, the CDC recommends the following to prevent the spread of respiratory viruses: wash your hands often with soap and water for at least 20 seconds, avoid touching your eyes, nose, and mouth with unwashed hands, avoid close contact with people who are sick, stay home when you are sick and clean and disinfect frequently touched objects and surfaces. People who traveled to China and became sick with fever, cough or difficulty breathing within the following 2 weeks should seek medical care right away, and call ahead to inform medical staff about their recent travel, the CDC said. The CDC does not recommend face masks for people who are well and without symptoms. The agency does recommend face masks for people who show symptoms of the virus and those taking care of someone sick with the virus, including healthcare workers. The best way to prevent infection with COVID-19 is to avoid being exposed to the virus, according to the CDC. In general, the CDC recommends the following to prevent the spread of respiratory viruses: wash your hands often with soap and water for at least 20 seconds, avoid touching your eyes, nose, and mouth with unwashed hands, avoid close contact with people who are sick, stay home when you are sick and clean and disinfect frequently touched objects and surfaces. People who traveled to China and became sick with fever, cough or difficulty breathing within the following 2 weeks should seek medical care right away, and call ahead to inform medical staff about their recent travel, the CDC said. The CDC does not recommend face masks for people who are well and without symptoms. The agency does recommend face masks for people who show symptoms of the virus and those taking care of someone sick with the virus, including healthcare workers.